So thank you guys for coming today. I appreciate having a big crowd here. I'm Brent, and I'm the medical student at Grand Itasca. So for our talk today, I want you to take from this talk that diabetes, Alzheimer's disease, heart disease, and arthritis, I want you to understand how you get these diseases, how we can prevent them, and how we're currently treating some of these diseases. So about me, my hometown is Sauk Rapids, Minnesota. It's right across the river from St. Cloud, Minnesota, so about 3 hours from here. And I did my undergraduate degree in biology at the University of Minnesota, Duluth, and then I stayed there for medical school. And I'm currently on a program called RPAP, and it's a program where we send medical students out into rural communities as opposed to training in the Twin Cities or Duluth. And I love it here as opposed to the cities. I was just telling the lovely ladies up here that it's less traffic, and I get much more one-on-one time with the doctors instead of having the residents in between, and getting a lot more hands-on than I would in the cities. So I am thinking internal medicine is the specialty that I want to go into, and that's a lot of the topics here tonight. I'm currently doing a rotation with Dr. Beyer, and I'm doing OB, so I just delivered a baby on Thursday, my first one, so that was a lot of fun. And it was a lovely couple, so it was a great story. And then I'm primarily working with Dr. Peel. He's the host for us students while I'm up here, and Dr. Sular too next year. Some of my personal interests, I enjoy hunting, fishing, running and exercising, and every summer I try and make a trip up to the Boundary Waters and spend a week up there. So that's what I like to do. So we're going to start out today talking about diabetes. So diabetes actually affects around 30 million people in the United States, or about 10% of our population. And the individuals in this room, as we get closer to 65, over a quarter of Americans over 65 have diabetes, which is a huge percentage. And we're increasing in prevalence of diabetes in this country, and it's estimated that each year, over 1.4 million new cases are diagnosed. In 2012, they estimated that almost 70 people died as the diabetes as the primary cause, and it was an underlying cause in another 234,000 deaths. And they estimate that 86 million people in this country have prediabetes, and we'll go over a little more of what the prediabetes is in a few slides. But it's very prevalent in our country, and it's something that we need to really target and take care of. So what actually is diabetes? So diabetes is a group of metabolic diseases in which there are high blood sugars in our bodies over a prolonged period of time. So what does that mean? It means that we have elevated sugar, both from the foods that we eat and the sugar that we make in our body by breaking down fats and things. And it's over a long period of time, and our body just doesn't know what to do with it. Also, it damages certain organs and blood vessels. So that's why it's such a bad disease. So diabetes can also lead to other health problems. Just having high blood sugar won't kill you. Your blood won't just become sweet and you'll die. It often leads to heart disease, stroke, high blood pressure, amputations, and frequent infections, because all this blood sugar coats all our blood vessels, and then it makes them really hard. So that leads to high blood pressure, and when you have high blood pressure, then it also affects the vessels on your heart, and your muscle, that is your heart, gets less oxygen. It has to work harder, and then you can have a heart attack. And if your vessels are harder, you have a better chance of having a clot form in there, and that can flow up to your brain and cause a stroke. And if you don't have good flow down to your feet, you can end up not having good circulation, no oxygen, no nutrients down to them, and you end up losing your feet, and that's how that works. And if the red blood cells can't get through to deliver oxygen, the white blood cells, which fight infections, can't get through either, and that's why diabetics often have more frequent infections. So how do you get diabetes? So there's two different types. There's type 1 diabetes, or juvenile diabetes as it used to be called, and that's commonly found in children, or that's when it's diagnosed, and it's when the pancreas doesn't create the hormone insulin, which tells the body to send the sugar inside the cells. We don't know exactly what causes type 1 diabetes. There's some theories out there that a virus attacks the body, and the body gets a little kill happy and not only kills the virus but sees something similar to it on the cells of the pancreas and attacks the pancreas as well, making it so the pancreas can no longer produce insulin. You can also get it by having a pancreatic tumor and then surgically removing that chunk of the pancreas, and if you don't have a pancreas, you can't make insulin. So that's type 1 diabetes, and that's much less common. So type 2 diabetes, we don't know exactly what causes type 2 diabetes. We can't say it's just from being overweight or just this or that, but it is certainly related to obesity, having a family history, multiple members having diabetes, lack of exercise, and a poor diet with lots of sugar. It's due to excess sugar in the blood, like I was talking before, and insulin is no longer effective. You've just got so much sugar that no matter how much insulin the pancreas pumps out, we can't get it out of our bloodstream and into our cells. Okay. So that's commonly a disease of the elderly or the obese people. So that's type 2 diabetes, and that's the more common one that when people talk about diabetes on the news, they're usually referring to that. So prediabetes, like I mentioned before, is where we have elevated blood sugar, but it's not to the levels to diagnose diabetes at. It's often blood sugar is less than about 125 or so chronically, and it's just about to diabetes, but not there. And often prediabetes will progress to diabetes if we don't make changes in your lifestyle and your diet. And then you'll be at increased risk for heart attacks, strokes, amputations, and things. So what do we do to treat diabetes? So the main thing is to eat healthy diet, low in sugar. We focus on lean meats, proteins, and really reducing sugars in our diet. And people say, well, I don't eat sugar, but things like even fruits have some sugar in them. That's why they taste sweet and good. And breads and pastas, those are loaded with complex sugars which get broken down into smaller sugar molecules in our intestine. So that will cause an increase in blood sugar, so we try and limit those things as much as possible. And the blood sugar in our body is like fuel for us, so if we burn up the excess fuel, that helps to keep our blood sugar low. So doing exercise to keep those blood sugars low, that helps. And when diet and exercise alone don't control your diabetes, we can add on medications that will either cause our liver to stop making so much blood or sugar, or to cause our pancreas to secrete more insulin to lower those levels kind of naturally. And if diabetes progresses far enough that all of those don't work, or the pancreas kind of just quits, then we'll supplement with insulin injections to kind of take over for the pancreas because it's kind of given up and not working anymore. So how can we prevent diabetes? That's the biggest thing which would save our country billions of dollars if everyone would just take this slide to heart. When I'm working with Dr. Peel in the primary care clinic, the biggest thing that we do when we see a patient with diabetes is tell them that weight loss will help control their diabetes, will help prevent diabetes. And it's not if someone is 300, 400 pounds, it's not you have to drop 200 pounds right now. It's if you drop as little as 10 to 15 pounds, or about 10 to 15% of your total body weight, your blood sugars will be substantially better controlled. So you don't have to make a huge jump to reduce your risk for diabetes. Some tips for weight loss: if you missed Dr. Peel's talk in November, his doc talk, try and reduce those calories to about 2,000 calories a day if you're significantly overweight or obese, or if you're just have a few extra pounds, try and target about 1,500 calories a day to try and drop a few pounds. And a good thing to do with that is to just keep a journal and write down all the foods that you eat and their calories, and be honest about your serving size. Try and measure some things out, because I may say that I have 1 serving of ice cream, but my serving is a big bowl. And I say it's 120 calories like it says in the package, when in reality it's probably 5 or 6 servings and 800 calories. So keeping that journal and actually measuring what your caloric intake is will really help you keep honest, and the pounds will come off much easier. You also, to prevent diabetes, want to decrease your diet in total sugar. So If you're in that pre-diabetes range or just want to be healthy, focus on lean meats, fruits, and vegetables. Don't just focus on fruits because there's still some sugar in there, but those, I'm not saying cut them out from your diet. They're very good for you as well. But things that you can cut out and should cut out are candy, soda, and unhealthy snacks. I mean, eating a bag of chips, there's lots of calories in there. There's carbohydrates, which are just complex sugars which are broken down. And those things, eat them very sparingly. Don't give them up entirely because then you'll crave them and you'll hate your diet and then you'll quit. So if you're trying to drop weight, you still have to have some enjoyment in your eating. And as far as exercise, we recommend 30 minutes a day, 5 days a week to reduce your risk for diabetes. And it doesn't have to be like those guys that have the big old muscles in the weight room in the back here. It can be something as simple as walking, swimming, dancing. And the key with that is just do something that you enjoy. This fall, I decided that I was going to go grouse hunting 3 times a week and just go hike 5 miles, and guess what? That's exercise too, and I enjoyed it a lot more than going and running on a treadmill. So find something that you enjoy is the biggest thing, and it's not exercise, it's not a workout, it's just doing something fun and having a positive benefit from it. Something that's not so applicable in Grand Rapids is taking the stairs. We don't have many skyscrapers or anything to burn the extra calories off. Kind of realized that after I put this together, but even just in the, do we even have any buildings with the elevators here? I guess the hospital has one. So if anyone goes in the basement at the hospital, take the stairs. But it burns extra calories throughout the day. So next we're going to talk about Alzheimer's disease. And I actually had a very intelligent professor at the University of Minnesota. He had gone to school for probably 15 years after high school. And he was some special pediatric cardiologist. And he said, he had a picture of a brain scan in his talk. And I said, well, what's that in there for? And he said, well, I was told by one of my professors that if you have a scan of a brain in your presentation, that people assume you're more smarter than you actually are. So here is my token brain scan to make you think that I'm all smart. But this is a good representation of Alzheimer's disease. Here's 2 different patients, and you can definitely see the changes here. These sections of the brain, they've actually lost brain matter here. And that's kind of how Alzheimer's works. This is the healthy brain on the left and the Alzheimer's disease brain on the right. And the brain kind of just wastes away. So Alzheimer's disease affects more than 5 million people in the US and over 48 million people worldwide. There was a rumor going around a few years ago that it was associated with the aluminum cans, the aluminum pots and pans that we've been using. And they've done multiple studies on this, and this is actually not true. There's no direct relationship. What they think that might be more related to it is lack of the vitamin B12, which is in a lot of animal products. And especially in Japan, we've noticed that those individuals who have a higher consumption of noodles and seaweed and that sort of thing, they don't have those proteins in their diet, and they have much higher incidence of Alzheimer's disease. So that's much more likely than aluminum. So the average life expectancy after being diagnosed with Alzheimer's disease is about 3 to 9 years. And there was some reports when I was doing this of Alzheimer's disease being in patients as early as age 35. So this is not just a disease of the elderly, even though that's primarily who gets it. Individuals can get it at a much younger age. The definitive way to make the diagnosis of Alzheimer's disease is on brain autopsy. So we're not going to kill every person with Alzheimer's disease to make it. So we've got some tests that we can assume that you have Alzheimer's with, but it's not definitive until after you die. And we can do that by your history, what your family's telling us that you're having trouble remembering, and your assessment. We'll ask questions, have you do a series of tasks in the office. So what is Alzheimer's disease? So a lot of people are confused at the difference between Alzheimer's disease and dementia. So Alzheimer's disease is actually a form of dementia. Dementia is just a overarching thing that has to do with memory impairment and loss of functioning in life. And Alzheimer's is a specific neurodegenerative disease of dementia. It results in brain changes which lead to memory loss, troubles concentrating, mood swings, and behavior issues, as pretty much everyone in this room has probably met someone with dementia or knows someone close to them. And it's different from dementia because there's often a single protein in the brain which kind of accumulates, and it leads to kind of like tangles in the wiring of your brain is a good analogy. And it just doesn't send the signals, and you have trouble recalling memories, and it's really sad. So how do we treat dementia and Alzheimer's disease particularly? What we have right now is a few medications that honestly don't work all that well. They do not reverse the course of disease. There's no cure for Alzheimer's disease, but we have been showing them to somewhat slow down the progression of it. That would be something to talk with your doctor if you have a loved one about the benefits versus the side effects of the drugs. Some people, it can prolong the disease for another 10 years. Others, it does nothing. So it's a very, very sad disease, and there's very little we can do to treat it. The biggest thing we can do is to just treat them with their daily activities and help them get around and be patient with them. Dr. Peel likes to tell his patients that Alzheimer's disease is like growing up in reverse. So you start out as a healthy adult, and then you slowly progress, just like you're going back to being a child, and eventually diapers and not being able to talk. And it's a good analogy, but that's pretty much how it works, and it's a good way to think of it. Is you wouldn't yell at a 2-year-old for not remembering a name or for having an accident. So just think of it that way when dealing with an individual with dementia. So how do you get Alzheimer's disease, and what can you do to avoid it? So a lot of Alzheimer's disease has to do with genetics. People with Down syndrome are particularly at risk of having Alzheimer's disease due to a genetic mutation in an extra chromosome, which leads to extra brain proteins. Another thing that everyone in this room can do is prevent head trauma. Individuals like especially hockey players, boxers, and the movie about the football players who are having concussions, they are at significant risk for dementia and Alzheimer's disease. So wearing a helmet when you're on a bike or on a motorcycle. Probably don't take up professional boxing. Hopefully none of you will here. And smoking. If you do smoke, it's a good idea to quit. That will help prevent your risk of dementia as well. But otherwise, genes play a big role in this too. And we don't know for sure all the causes of dementia. And it's something that we really need to focus more on as a country, at how we can prevent and treat this and slow it down. So what can you guys do to prevent it? The biggest thing is to keep your mind sharp. You're all out and socializing right now. That is a huge part of keeping that mind active and not letting it atrophy or lose the matter in there. They also recommend reading, doing puzzles, exercise, musical instruments, things that use different parts of your brain, both the motor parts and the memory parts, as well as the talking. So having that active lifestyle, and they also recommend a healthy diet to prevent Alzheimer's disease. So if it's an excuse for you to enjoy a good glass of red wine, there you go. You can say you're preventing Alzheimer's disease. They say 1 glass a day. It can't be the sugary sweet red wine like my wife likes to have. It's got to be an actual good quality bottle of red wine. I'm not saying you have to spend $50, but a $6 bottle of the cheap stuff works too, as long as it's just not all sugar and dyed red. They say that caffeine also helps, and then a balanced diet with lots of fruits and vegetables, lean proteins. That helps as well. So next we're going to talk about heart disease. So does anyone know what heart disease is as far as the number killer or a cause of death? It's the number 1 cause, that's right. This is for both men and women. So it is incredibly important, and 610,000 people die of heart disease every year in the United States. That results in 1 out of every 4 deaths in this country is from heart disease. Comparable is, we hear all the time on the news, we get calls for the women in the room to come get your mammogram. We spend millions and millions of dollars on breast cancer research. And for every 4 women that die of breast cancer, there's 61 that die of heart disease. So I think our society's kind of got it backwards. Breast cancer is a terrible disease, don't get me wrong, but we need to focus more on heart disease and preventing this in our country, focusing our money on preventing heart attacks and strokes, because it affects way more than breast cancer in women, prostate cancer in men, and even lung cancer. Those dang smokers getting lung cancer are not even half of what is caused by heart disease. And it's estimated that 735,000 Americans will have a heart attack this year. So it's a huge amount, and it should be the #1 concern for this talk. So what is heart disease? They throw that around all the time, and it's not really clear what that actually is. So heart disease is a broad range of conditions. It can include diseases of the vessels on the heart, which can lead to heart attacks, and if the heart's not pumping well, we can have poor blood flow, and you'll see lots of swelling and things like that. Heart disease can also refer to heart rhythm problems and heart defects, but often those are corrected and don't cause death as much as heart attacks and heart failure do. So the risk factors for heart disease are smoking, and then we talked a little bit with diabetes about how the excess sugar will coat the blood vessels, and that is a major risk factor, is the poorly controlled diabetes, well as high blood pressure, having high cholesterol, and these are kind of associated with being obese and having a sedentary lifestyle. And there is a genetic component as well, so if everyone else in your family has heart disease, then you're at risk of having heart disease as well. So what do we do to treat heart disease? So we need to stop the progression. If you have high blood pressure, we need to reduce your blood pressure with some medications and exercise. If you have diabetes, we need to control the diabetes. Some medications that we commonly use, we use a lot of the blood pressure medications control our body fluid levels as well as our electrolytes and sodium levels. If your heart is pumping really fast and hard, it's going to tucker out a lot easier, so sometimes we'll control the rate and slow it down, as well as sometimes we'll do heart surgery to fix the inside defects or to open up the clogged vessels on the heart. So what we can do to prevent heart disease is the #1 thing is to stop smoking. We talked about all the lung cancer deaths on there, but smoking probably plays a part in about half the heart attacks in our country every year. So not only is it bad for your lungs, it's also bad for your heart. You also want to control the diabetes, keep those sugars low. That'll help prevent it as well. There's evidence by the United States Health Service Preventive Task Force, I don't know if I got that right, to take a baby aspirin every day over the age of 45. I'm not saying all of you go out and do that. Talk to your family doctor about that. Some are for it, some are against. That's a suggestion. And weight loss, exercise, and blood pressure control has no bad effect on your heart, unless you're anorexic and way too little, but those are definite benefits for heart disease. So we're going to talk briefly about arthritis. There are over 100 different forms of arthritis, which was a fact that I didn't even know till I put this talk together. And arthritis is not a new disease. It actually was found that it affects dinosaurs, and I'm not just talking old people. They actually found it in the fossils of dinosaurs. It showed the wearing out of their bones when they dug them up. And they even saw that mummies, as far as 4500 BC, showed evidence of rheumatoid arthritis. So this is not a new disease. And the first treatment for arthritis was willow bark. And do you guys know what the active ingredient in willow bark is? Salicylic acid, which is also known as aspirin. So that's how they came up with aspirin, is they used to chew on it to treat.
I take that.
Yeah, so they chewed on willow bark, and then they eventually isolated that compound, and that's how we got aspirin. So arthritis is a broad term meaning inflammation of our joints. It's the #1 cause of disability in our country. If you look around at work, you can see people with worn out joints in their hands, aching hips, knees, and it's kind of one of the things of aging. So how do you get arthritis? Arthritis can be either genetic or autoimmune, where you're going to get it no matter what. The The autoimmune is where your body kind of attacks your joints, and that's your rheumatoid or your psoriasis or psoriatic related arthritis. Otherwise, like most people get, it's just overuse of your joints. A lot of pounding and a hard life's work will lead to arthritis as well. And there's also some infectious arthritis, but that's a lot more rare and is due to infection in the joints. And you would know if you've had that because you'd probably end up in the hospital for IV antibiotics. But the main thing with arthritis is prevention. And if you have arthritis, there's not a lot you can do to prevent it more. So you'd be better off in buying a time machine and going back and having a talk with yourself. But some things that you can definitely do is maintain a healthy weight for especially your hips and your knees. And it's estimated that for every 1 pound of weight loss you have, it's equivalent to taking 4 pounds off your knees. So if you're 20 pounds overweight, that's 80 pounds extra on your joints with the movement and the physics of that. So for gout, that is a special form of arthritis, and they recommend a diet low in alcohol, sugar, and red meats. That's a special one, and if you have gout, we're not going to talk too much about that. You can talk with your primary doctor about that. And smoking is also a risk factor for the autoimmune arthritis. So if you're a smoker and you have a rheumatoid arthritis or psoriatic arthritis, the cigarettes are not doing you any good. It's recommended that you quit them, and your arthritis should hopefully improve. So what we do to treat most arthritis is we treat it with over-the-counter pain medication like Tylenol or ibuprofen, naproxen, or the willow bark aspirin. Don't go cutting down trees, chewing on it. Just spend the $2 on a bottle of aspirin. And once it gets really bad, you'll know when it's time. There's joint replacement options for your big joints. I believe Dr. Erickson does shoulders, maybe elbows, but for sure hips and knees. The fingers, we haven't got there yet, and I don't know if we ever will. Sorry for all you guys who have the old worn out fingers, but some person in the country probably does it. And the big treatment is like we were talking, the 4 pounds off, so lose the weight, and it's 4 pounds off your knees and your hips. And your doctor can also prescribe certain prescription anti-inflammatories that are a little more potent than your Tylenol and ibuprofen. And then if you have certain forms of arthritis like psoriatic arthritis or gout, then we've got special medications designated for those as well that you can talk to your doctor about going on. So in conclusion of this talk, an active lifestyle, a healthy diet, and quitting smoking, as well as being social, are helpful in the prevention of all the diseases that we talked about today. And they help prevent aging and have no bad side effects. So be active, quit smoking, and a little bit of weight loss will really help you stay young. You may not look young, but you'll be young on the inside. So, and thank you guys for coming.